try to get around parents being there if the patient doesn't want them. So always make sure when you're talking to your patients and trying to get that consent to always explain and make sure that they understand what's going on, and then be honest about the potential pain. Even with younger kids, you never want to lie to them. So if I take my younger kid in to get a shot and I tell them, oh, it doesn't hurt, and give them a shot and it hurts them, they're never going to trust me again. So make sure that you always tell them if it's going to hurt or not. Maintain a patient confidentiality. That means not going out and talking about, oh my gosh, I just had this 14-year-old who was pregnant or whatever. Make sure that you maintain that patient confidentiality, because you never know who's going to be listening. There was a case where a nurse was in I think it was the ICU in the PICU, and she had a really rough day and just didn't know, where to turn. So she started talking to her neighbor about what had gone on in the PICU that day and about this patient she had. And she didn't use any names, but the neighbor looked at her and said, oh, that sounds like my niece's daughter. So, you never know who you're actually talking to, so make sure and keep those things to yourself. Nobody wants to get in trouble for HIPAA. That's like a $100,000 fine. Talking about health promotion and education, the assessment, the HEDS assessment. HEDS stands for Home, Education, Activity, Drugs, Diet, Sexuality, Suicide, and Safety. When you're assessing the home, you're assessing the caregiver and the siblings' relationships, support of the extended family where the adolescent chooses to live, substance abuse in the home, violence in the home, safety of the neighborhood that they're in, and also community support and resources. So talking about education, assessment of their school, do they go to school, are they absent a lot? Feelings regarding teachers and classmates, any kind of bullying that might be going on with them. And then ask about vocational career aspirations. So what do they want to do when they grow up? Like, are they working towards maybe a path that they want to take? Activities, the assessment of mortality. Teenagers believe that they're indestructible. So we have to kind of put the brakes on that. I know teenagers that think that they can jump out of trees and dive into water, jump off of bridges, things like that. In my hometown, there's actually a sign on the bridge that says, do not jump from bridge, because there have been people that decided that was a good idea. So making sure that they're very careful, ask them about any kind of driving history, or finding out if they've been in accidents. Did you know that the leading cause of death is MVA, homicide and suicide? And asking that teenager if they actually know how to prevent some of these things. How do you prevent an MVA? Maybe drive slower. My son decided, he's 19. My son goes out in my husband's car and drives like 100 miles per hour with me in the car. So I know he does it when he's on his own. So we just try to teach him that's not the best way to go. Assess for the presence of violence, not just physical violence, but also mental abuse of the teenager. Growing up in a, if teenagers are growing up in a mentally abusive household, it can lead to physical abuse. So asking them how their household life is, or ask them how their home life is. Drugs and diet, so screen for tobacco use, alcohol, substance abuse. Also screen for nutrition. We want to catch any kind of bad eating habits as early as we can, especially those kids who are more on the side of bulimia or anorexia. Making sure they're at a healthy weight, and then talking to them about what a healthy weight is. Sexuality, assess sexual status, what kind of birth control they're using, any history of STDs. Kids don't really think about that most of the time. That's why we have a really high incidence of teen pregnancy. actually give them, whether they want to talk about it or not, tell them, here's some information about STDs, here's information about how not to get pregnant, and then making sure that they understand what you're telling them. Suicide and safety, screen for depression, suicidal ideation, and self-harming. Like I said, suicide is really high in the teenage population. Um, I used to work in the PICU. I've had several people come in, attempted suicides. It happens all the time. As young as even, I had a 12-year-old that came in that hung himself in his closet with a belt. So it happens at early ages. I mean, even before the whole puberty starts. So make sure that you're talking with your patients about feeling safe. Are they having signs, or ask them if they're feeling like suicide or if they have a plan. It should be in all, because it's a national problem, so it should be in all admission documentation. So as you're filling out that admission documentation, there should be a Columbia suicide or something to those effects that you would ask all children over the age of 8. Any questions so far, guys?
Nope.
Okay. So at what age is a patient considered to be middle adolescent? You guys know?
Is it B?
It's actually C. So 15 to 17 years of age is considered to be middle adolescent. Emergency care of those kids. So make sure that when you're assessing, you're looking at those ABCs. Assess for pain and look at skin for evidence of drug use. Talk with a guardian. Minors can be treated without consent under the Emergency Medical Treatment and Active Labor Act of 1986. Do you guys know what EMTALA means? So EMTALA is the law of the Emergency Medical Treatment and Active Labor Act of 1986, also known as EMTALA, says that any person that comes to a hospital has to be treated, no matter what it is. I work at a children's hospital. If somebody pulls up and drops off an adult who's been shot, we have to take care of them. We also get a lot of people coming in who are pregnant, about to give birth. They come in, we have to take care of them. We can't just ship them off to the next hospital. We have an adult hospital right next door. We can't say, oh, sorry, you're over the age of 21, you have to go next door. So we have to make sure and treat them until they are stable, and then able to transport them to the next, to the appropriate facility. So because of that act, you'll find yourself in ERs having kids that's an adult hospital, or you'll have adults in a child's hospital. So during an emergency care, you can take your patient anywhere that they can, be seen. Educate families on care and what to plan for. So your role is mainly just taking care of the patient and educating the families and letting them know what's going on, especially if you're dealing with teenagers or with children in general. You're not just treating the child anymore, you're treating the family as well. So acute care hospitalization, the environment of care. So provide a sense of control and reducing feelings of anxiety. Make sure the teen has appropriate entertainment. So Child Life is really good at coming around and making sure that they have the entertainment that they need to get through a hospitalization. Different games to play. They bring along the Xbox or whatever the kid's into. It's all set up through donations to the hospital. Child Life also has a degree in trying to figure out what developmental stage they're in as well. So they can really help out a lot. Encourage adolescents' participation in meetings with healthcare needs, making sure that adolescent knows what's going on. it's not too much longer, they're going to be an adult, especially if this is something that goes on for the rest of their life. Be honest about pain, like I said, and side effects. And you want to try to show the equipment before time, before you actually use it, if it's going to be something scary. I'm trying to talk to them in their developmental stage. A lot of teenagers can be, more mature for their age, but some teenagers are definitely less mature for their age. So make sure that they're understanding and you're not scaring them. So caring for chronically ill adolescents. Physical care is important. Go back. Physical care is important. Trying to make sure that they are understanding what is happening by educating. Assess the caregiver burden and get respite care if needed. So you guys talked about respite care before. Okay, so respite care, is something that you do for the caregiver to kind of give them a break. So maybe that needs to happen. If they're in the hospital, those parents can go home. They don't have to stay. Even if the child is a small child, that's what, the nursing staff is there for. They can help watch the kid. Now, we like them to stay because it's a little easier on us, but they don't have to. Maybe they need some of that respite care to get away for just a few minutes. Spiritual care, refer to appropriate internet resources, advocate for your families, making sure that they get the care that they need as well, and let the adolescent do as much as they can. Don't just do everything for that kid. Let them do more and more for themselves, as much as they're able to do. Home care considerations, decreased need for hospitalization. So going into the home, a lot of times the hospitals will try to get that patient home as quickly as possible. So home care, what it does is it increases the family and adolescent satisfaction by getting them out of the hospital and back to the house. There are plenty of home care agencies out there that will help. Insurances most of the time pays for home care, at least for a few sessions. And it benefits, sometimes, your house for an adolescent is the safe zone. So it gets them back to the safe zone so they feel more comfortable. So CAM, complementary and alternative therapies. So CAM is herbal and dietary supplements, chiropractors, massage therapists, things that people that are not your usual healthcare providers. The only thing with like herbal and dietary supplements I have to warn you about is they're not regulated by the FDA. So they have a wide variation in content across different companies. Make sure that whenever you're talking with your teenager and finding out what medications they're on, that you're asking about herbal supplements. Sometimes parents and teens alike will hear about something on the internet, how it's supposed to make you feel better. They'll start taking it, but they don't realize that it has that contraindication with the medication that they're taking. So they could be hurting themselves instead of actually making things better. Looking for interactions between what they're doing at home and what the doctor's prescribing. So making sure you find out all of the different types of medications, the herbal medicines, and then chiropractic, massage therapy, things like that, because sometimes it is contraindicated, especially kids, I don't know, with spine issues. You wouldn't want them to go to a chiropractor. I mean, simple like that. Child abuse. Child abuse is a sad thing in this day and age. Physical, emotional, and sexual abuse. Helping those children report those issues, being on the lookout for those issues. Kids don't always say what's going on because they're afraid. So asking the questions and then watching for reactions is important. And then you have a bunch about human trafficking. I know in Ohio it's pretty bad. Here in St. Louis, we're one of the big hubs of human trafficking because of all the interstates that come through here. There was my daughter who lives up there in Ohio. She lives in Akron. She was driving to work one day and had some people, like a couple of cars passing her and slowing down and getting behind her and just acting really strange. And so she called the police and got off at her exit, and the police were like right there, but they told her that that's a way that they're getting people nowadays, is they'll box them in and make them force them over to the side of the road and then kidnap them. So be very careful about, things that don't seem right. Make sure that you're contacting someone. It doesn't hurt to call the police and say, hey, something's not right. Just be very careful. So in emergency care of adolescent, which of the following is included in the primary assessment? You guys know? It's actually all of the above. It's A, ability to recite ABCs, assessing skin for evidence of drug use, and also knowing their immunization status. In summary of this chapter, like growth and development, biosocial assessment, making sure that you go through that biosocial assessment, biopsychosocial, I could get right here, assessment, asking the questions. It's very important, like I said, to ask the questions about suicide, ask the questions about home care, ask them about any kind of child abuse. Do they feel safe at home and things like that? Because they are going into, adulthood, they need to learn how to take care of themselves. So make sure that when you're talking to them, you're not just handing them out information, you're actually explaining everything to them. Does anybody have any questions? No? Okay. So reproductive and genetic disorders. I have to tell you, this is not my favorite chapter at all. Going through these reproductive and genetic disorder, I usually blush a lot, so just bear with me. So identifying the anatomy of the male and female reproductive system, discuss common pediatric reproductive health concerns, describe the signs and symptoms and interventions for common sexually transmitted infections, and explain the human genome and its function. So I kind of kept this to mainly what's going on with each stage of puberty. So for girls, puberty is pubarch, thearch, and medarche. So what those mean are 3 stages. So pubarche is appearance of pubic hair. Thearche is appearance of the breast tissue maturation. And then menarche is the onset of their first menstrual cycle. And those are the 3 stages for puberty for girls. So common pediatric problems in the female would be straddle injury. Have you ever heard of straddle injuries? So straddle injury is like when you fall and straddle something like a bike, or you get a hematoma in the vaginal area. There are 3 different types of straddle injuries. There's, and it's by size, so small would be the size of an egg would be a small one. And what you want to do for that is just ice packs and pressures for 12 to 24 hours. For a medium size, it would be about the size of an orange. And then you'd want to add sitz bath to that. So sitting in some warm water with some Epsom salt, about 15, 20 minutes every few hours will help with that. And then a large injury would be the size of a grapefruit or greater than 15 centimeters. Must assess for urethral obstruction. Sometimes when they have them that large, they have to have a suprapubic catheter put in because it's blocking all of the exits, so they can't urinate. Lacerations or skin tears. Sometimes when you have laceration or skin tear, it's usually with labral or vulvar tears. Best to not suture those because it wants to heal from the inside out, because if you suture them, you could possibly make them have an abscess. We also have things like vulval vaginitis. Vulval vaginitis is an inflammation of the vulva and the vaginal areas. It's most common complaint of prepubescent girls. The symptoms are vaginal itching, soreness, redness, then vaginal discharge or painful urination. They're more susceptible to this because prepubescent girls are more susceptible because the labial tissue lacks estrogen. Tissue is thinner and more susceptible. Infection caused by irritation in the vaginal area, and may also indicate the presence of foreign body that usually presents with like an odor or thin vaginal secretions. Pinworms can be a cause of vulval vaginitis. Pinworms can come out usually seen in the intestines. So what they usually do is they do a tape test. So they put a piece of tape over the child's rectal area at nighttime, and then in the morning they'll see if there's any kind of worm that is on there because they come out at night. So they tape the rectal area to catch them. I know it sounds really weird, but it's actually what they do. And it's pretty disgusting, but whenever you see it, you'll understand. As soon as it gets daytime, the worms go back up inside the patient and you never find them. So this is a way to catch them and make sure that's what they have. It's non-sexually transmitted, so it's not like it can be sexually transmitted, but most of the time the vulval vaginitis is not sexually transmitted. It can be from a viral infection such as flu A, Epstein-Barr virus, cytomegalovirus. Should also test for things like herpes simplex virus 1 and 2. Intervention may require a Foley. Topical antibiotics usually heals in 1 to 3 weeks. Make sure to address the pain management because that's what's really bothering them is that pain management. Bacterial vaginosis is common cause of vaginal discharge in adolescents and women of childbearing ages. Most have minimal symptoms, but symptoms of fishy smell, thin, whitish gray discharge. It's not the result of one organism, but a complex change in normal vaginal organisms and increase in organisms. So about a third of the cases resolve spontaneously. Other ones have to have medication to fix. Abnormal uterine bleeding are called AUB. In teens, are caused by sometimes cycles that don't actually produce an egg. So they're just a cycle that the teens go through. And it's usually from having a new period. So when you first start having your period, sometimes it'll be heavier, sometimes it'll be lighter. So the female having, or the child having a new period sometimes skips. And then like the next one will be a heavier. They're not actually producing an egg every time. So that's why it kind of differs until their periods get regulated. Amenorrhea is a period has never been present, or it starts and then it stops again. Average age of kids getting their period is 12.3 years. 95% of them have it by the time they're 14. And if they don't have it by the time they're 16, then you should probably take them to a doctor and find out what's going on. Maybe they have a hormone deficiency. Let's see. Puberty in boys is common, is a little bit more, how can I say, challenging, because they really don't understand what's going on with their bodies unless they're educated about it. So education is really important. Enlargement of the genitals in both length and size, enlargement of testicles, pubic hair develops, increase of body hair, deepening of the voice, and rapid skeletal and muscle growth. It makes them grow pretty fast, even in girls changing for puberty. A lot of times boys and girls, if they grow too fast, will have pains in their legs or in their arms. It's just their body growing, and they have to do. I used to have to stand against a wall and bend down and touch my toes to get my legs to stop hurting, because I grew a lot. I grew like 6 inches in one summer. So when they grow too fast, it's painful, and you have to understand how to work with that. Common pediatric and adolescent problems of the male genital tract. Physmosis is defined as the inability to retract the foreskin covering the head of the penis. Physmosis may appear at tight rings or rubber bands of foreskin around the penis. It's divided into 2 forms, so you have your physiologic and your pathologic. Most of this is fixed whenever babies are circumcised, but for the kids that don't get circumcised, you kind of have to be careful. Physiologic physmosis is a rule in newborn males. The pubis is adhered to the glands and separates over time. So don't try to force it. So it says that enthusiastic attempts to retract the foreskin causes micro tears and infections. So be very careful with a child that has still has their foreskin. There are also development of testes. Kids just don't really understand what's going on, so just explaining to them is a good way to help them out. Oops. Risk factors for STIs. Oh, there's a lot of risk factors for STIs. Risk factors for sexually transmitted diseases, like multiple partners, new partners, partners with multiple other partners. Really asking about how many people they're having sex with, and how many people the people that they're having sex with is having sex with, can help determine their risk factors for those STIs. Screening for sexually transmitted diseases, the CDC and American College of Gynecology recommends annual screens for all sexually active females aged 25 and below. Annual gonorrhea tests and HIV tests, and should have routine screens for STIs such as syphilis, trichomoniasis, and bacterial vaginosis and herpes. So getting those screenings done if they're sexually active is important. Pelvic inflammatory disease, acute infection of the upper genital tract structures in women, caused most often by genital gonorrhea and the effect of other infections. Interventions would be to complete antibiotic regime, educate to take meds, provide pain management, teach signs and symptoms, and educate a prevention of those STIs. So making sure that humans are the only, telling them that humans are the only natural host for transmission, and is almost nearly through sexual contact. Gonorrhea can be occur in the cervix, vagina, fallopian tubes, but can also appear in the eye, the throat, the urethra, and anus of males and females. Can be spread from mother to infant during birth. And signs of gonorrhea are yellow, white, or green urethral discharge, more often in men. Symptoms of rectal infection, sore throat, eye redness, interventions are to obtain cultures and educate the importance of antibiotics. And this right here is your gonorrhea eye. So it has gonorrhea in its eyes. It's all red. It kind of looks like pink eye. Chlamydia is one of the most common sexually transmitted diseases. Bacterial agent of sexually transmitted genital infection, usually asymptomatic. Conjunctivitis and pneumonia can occur in infants born to mothers through an infected birth canal. All mothers should be screened to make sure that they don't have chlamydia or any sexually transmitted diseases. Syphilis has been, another one is syphilis has been called the great imitator because so many of the signs and symptoms are indistinguishable from other things. So first starts off with a sore that they usually have on their penis or in the mouth, on the tongue, and it's 3 to 90 days after exposure. Then you move on to a body rash for 4 to 10 weeks after initial infection. And then years and years and years later, you can come up with other effects that affects internal organs. So years and years later, they have problems with dementia, or they have problems with their heart or their lungs. This can all be from syphilis. So getting tested would be very important for them. They could get it stopped if they get tested, but a lot of people actually do die from syphilis because they don't know that's what's going on and they're not getting tested for it. And then this is what congenital syphilis looks like. This is a baby that has had contracted syphilis from the parent through the birth canal. So menorrhea, so do you guys know what that is?
Yes.
What is it? Which one is it?
Oh, 1 second. I got to read it. Hold on.
Okay. She can answer, or he.
Yeah. It is C.
Yes, very good. Menstrual flow of excessive duration and or volume. So characterized by menstrual flow of excessive duration greater than 7 days and or heavy volume, greater than 80 milliliters a cycle. That's a lot. I've actually seen the worst case of this that I've seen is a kid came into a PICU, teenager, and her hemoglobin was actually 1.7. So that's very, very low, and they had to have lots and lots of blood during that time. They were just like, I'm just so tired. I'm like, I wonder why. They just slept all the time. So finally got it back up. She did well after we gave her some antibiotics, and they did some tests to find out what was going on and why she was having such heavy menstrual flow. Genetics and genetic disorders. So trisomy 21 is the one we're going to start with. So trisomy 21 is having an extra chromosome on that 21 chromosome. So you'll have 3 of those 21 chromosomes when you're only supposed to have 2. So you have 46 chromosomes organized into 23 pairs. Each pair contains 2 copies of those allies. There are 22 pairs of autosomes, which both males and females have. There's 1 pair of sex chromosomes, 1 from each parent. These are the X and the Y chromosomes that determine your sex. Females have XX and males are XY. So defects occur with the ongoing process of cell reproduction. When an egg and sperm unite and get the 46 chromosomes, sometimes those chromosomes mess up and you get genetic syndromes. So trisomy 21 is Down syndrome. This is where there are 3 copies of the chromosome 21. Instead of having 46 chromosomes, they have 47, so they have an extra chromosome. This is associated with advanced maternal age, so over 35. Features of Down syndrome are small head, flattened broad head, flat posterior areas, underdeveloped, flattened middle of the face, almond-shaped upslanting eyes, protruding tongues, small low-set ears, heart murmurs related to defects in the heart, low tone and can be floppy with breathing and feeding problems at birth. So they don't have the tone to keep their airways open or their to be able to feed correctly. So their tongue is really big and they can't seem to suck on those bottles. A lot of them have to be fed with a feeding tube for a little while. Several birth defects, such as atresia of the duodenum. So there's like the duodenum doesn't go all the way through. There's like an empty pocket. So Hirschsprung's disease, motor development takes about twice as long. So they have a development delay. And then they also have hair loss and thinning hair. Trisomy 18 or Edwards syndrome is just 3 of those trisomy 18, so 3 of the 18 chromosomes. Characterized by prenatal growth deficiency, craniofacial features, characteristic hand gestures with overriding fingers, nail hypoplasia, short sternum, internal anomalies, and severe heart defects are common. The next one is trisomy 13, Bateau syndrome. Usually not compatible with life, so they usually pass away within 3 days. Sometimes they can live up to, depending on how bad their symptoms are, they can live up to a year or maybe 2, but they don't live very long. It's the least common, but the most severe of the trisomies. Turner syndrome. It kind of looks like Turner syndrome. Is the entire loss of the X chromosome, only known disorder where fetus can survive despite the loss of an entire chromosome. It affects only girls. Children do not receive a sex chromosome from their father. Symptoms are prematurity, feeding difficulties, GERD, failure to thrive. Physical findings are short stature, wide space nipples, non-functional ovaries, thyroid dysfunction, heart defects. They have normal intelligence most of the time, but visual impairments. They also may have only 1 kidney or a misshapen kidney. Can also have notable swelling or puffiness of the hands and feet. Crude-Duchat syndrome is also called the cat cry syndrome because whenever they cry, they actually sound like a cat. Profound microcephaly, so they have a small head, a round face, wide-spaced eyes, low-set ears. I do not know what it's doing right now. Williams syndrome is the next one. Results in microdeletion of the long arm of the chromosome 7. Characteristic pattern of dysmorphic facial features are broad forehead, bitemporal narrowing, low nasal root, preorbital fullness, a bigger nose, crossover wandering eyes, full cheeks, small jaw, prominent earlobes, developmental delays ranging from low normal to severe, connective tissue abnormalities, including cardiovascular disease, and then the velocardiofacial syndrome is because of a problem with the chromosome 22. It's also called DeGeorge syndrome. Presence of cleft palate and heart defects should indicate need for chromosomal testing. So right-sided heart defects is what they usually have, or defects of that aortic arch. Subtle face appearances, mild developmental delays. Classic DeGeorge sequence includes absent thymus, hypocalcemia, and immunodeficiency with characteristic facial features. So usually if you've seen a kid with DeGeorge syndrome, you'll know what they look like the next time. PKU is a depletion of the enzyme phenylalanine. So it's an abnormality in that production enzyme that breaks down the protein phenylalanine. It's also screened for at birth. So all 50 states screen for this at birth so that they can catch it early. When you have PKU, you're on a special diet. You're not able to break down proteins very well. So you're on a special diet your entire life. And it's a pretty significant decrease in most foods. So a high phenylalanine diet would be like fish and dairy, wheat, meat, eggs, but they're only allowed to eat certain things. You can't take the protein out of everything. So they are given a scale of what they can have. So they're usually tiny kids. They're only allowed to eat certain things, vegetables mainly. Breads, some cookies, crackers, just making sure to keep that protein level low. They live with it for life, even if they become pregnant themselves. They need to go to genetic counseling, and they also need to make sure that they are a high-risk pregnancy. Neurofibromatosis type 1. Sorry, I'm getting dry. Neurofibromatosis 1 is there's type 1, the result of single mutation of the long arm of chromosome 17. Males or females can get it. 50% chance of passing it to their kids. Neurofibrin is a tumor suppressor, so they don't have the tumor suppressor. So they get a lot of tumors throughout their years. Characteristics are 6 or more cafe a lot pigmented birthmarks. So they have these birthmarks they get when they're born. That kind of keep their, sorry, I'm trying to lose my train of thought. They keep the birthmarks, they keep track of the birthmarks because they get more and more as the time goes on. They also have tumors that spread throughout their brain, and they're usually benign tumors, but they affect things like, could possibly give them seizures. And then neurofibromatosis 2 is a hereditary condition most commonly associated with bilateral vestibular acoustic neuromas, so in the ears. They get tumors in their ears. Tuberous sclerosis causes benign growths, cause tumors to form in the brain, eyes, kidney, heart, skin, and lungs. Occurs in 1 in 6,000 births. Diagnosis is based on clinical findings and an MRI. All you can do is manage the symptoms, and sometimes surgery is required to remove the tumors from those vital organs. Seizures are also something that you need to be aware of in these kids. So the neurofibromatosis 1, 2, and tuberous sclerosis all have possible tumors on the brain where you have to manage seizures. Serge-Weber syndrome is a rare condition caused by spontaneous genetic mutation that affects the skin and the brain. The cause is unknown. The most common symptom is skin lesions called port wine stain and is present at birth. Blood vessel growth called angiomas can occur on the brain and cause seizures. Seizures usually start before their first birthday. The angiomas cause seizures that tend to worsen with age and may be convulsions on the opposite side of the body from the skin discoloration. So if they have the skin discoloration on the right, then their seizures will be on the left. An MRI of the brain and brain blood vessels should be performed to evaluate for these angiomas. Treatment is aimed at symptom management. Measures to prevent should be put into place. Weight management is important, control of blood pressure. These kids can have strokes very easily. So Charcot-Marie tooth disease is an inherited form of neuropathy that primarily affects the feet and legs, but can affect the arms and hands at advanced stages. Sometimes, usually it manifests in late childhood or adolescence, and usually begin with foot drop. Diagnosis can be made on symptoms. Blood tests are also sent out for genetic markers. Electromyography is done to determine the extent of the disease, and nerve conduction velocity are done to determine the speed of the nerves that are conducting. Achondroplasia is a group of disorders called chondros dystrophies. This disorder is a bone growth that causes the most common type of dwarfism, so usually inherited as an autosomal dominant trait. They have abnormal hand appearance and persistent space between long and ring fingers to form like a trident-shaped hand. Children often have a delay in milestones due to tone, so their tone is not really good for them. That X-linked hydrocephalus is an X-linked recessive disorder. Males are affected. The most common genetic form of congenital hydrocephalus with stenosis of aqueduct of Sylvius. So close monitoring of the head circumference and then management of a CNS shunt is placed. So assessment for age-appropriate developmental delays will be important. So they put in a shunt to drain the hydrocephaly. Fragile X syndrome, formerly known as Fragile X mental retardation syndrome. So the interventions, routine well child care and immunization should be performed. Seizures occur in about 20%. Newborns can have feeding issues, and mild motor delay are common. Heart murmurs require echo and monitoring of the mitral valve. Prader-Willi is a genetic condition that affects many parts of the body. Infants with Prader-Willi syndrome have severe hypotonia, so they have low muscle tone. They have feeding difficulties and slow growth. Later in infancy or early childhood, they start eating more, and the Prader-Willi kids cannot stop eating, so they get very large, and they have to be helped with restrictions of their diet and not letting them eat so much. I had a Prader-Willi kid in the PICU who was probably about 200 to 300 pounds, and he was only like 12. So he had so much extra weight on him that it was causing problems with breathing, causing problems with his heart. And it was just because he was very strong and big. So he would overrun his mom, who was trying to keep him out of the food, but he would tear things apart to get to it. And their mental capacity is not very much. So they don't understand what they're doing. They just have a need for food, and they eat, and it makes them feel better. So it's a very sad disease to watch. Having fetal alcohol spectrum disorder. So fetal alcohol, oh sorry, I forgot Angelman syndrome. It's a deletion on maternal chromosome 15. Developmental delay, mental retardation, severe speech and language impairment, problems with movement, coordination, and balance. They're usually happy. They have a laughing demeanor, so they're very happy all the time. They have hand flapping behavior, so they talk with their hands a lot. They can also have hyperactivity, short attention spans, short sleep cycles, again, epilepsy. Scoliosis is common. Treatment is aimed at supportive care. Fetal alcohol syndrome disorder is what we're going to talk about next. So the fetal alcohol spectrum disorder, there are several, going from mild to more severe. It's caused by exposure to alcohol whenever the kids are in utero. So fetal alcohol syndrome disorder 1. This is the most severe form of FASD and is defined by abnormalities in 3 domains. So poor growth, abnormal brain growth and structure, and specific dysmorphic facial features. Prenatal alcohol exposure may or may not be confirmed. So 2 would be partial fetal alcohol syndrome. These children display the typical facial dysmorphic features. They have abnormalities in one of their other domains, and prenatal alcohol exposure is confirmed. So they actually know that this is actually happening. Alcohol-related birth defects. These children have the typical facial features associated with fetal alcohol syndrome, normal growth, normal brain function and structure, but have structural congenital anomalies in other organs such as cardiac or renal. Alcohol-related neurodevelopment disorder. These children have normal growth and lack of facial features, but display a pattern of behavior or congenital anomalies typical of prenatal alcohol exposure. Children are at risk for significant cognitive impairment, abnormalities on testing of verbal learning and minor skills. They also have a low IQ. So the interventions are, there may be difficulty with suck, swallow, breath coordination, or aspiration. So a lot of them are GI feeders, so they have to have that feeding tube. In Edwards syndrome, each chromosome has how many copies of what chromosome? Do you guys remember? So it's actually A, 3 copies of chromosome 18. So they have craniofacial features, characteristic hand gestures, and overriding fingers. So just in summary, we talked about female anatomy physiology, male anatomy physiology, sexually transmitted infections, and genetic orders. So things that you need to know about communicable diseases. Do you guys have any questions about genetic disorders? Not my favorite thing to talk about, but communicable diseases, describing the source and transmission of various communicable diseases. We're going to outline critical components of history for a child, describe the clinical presentation. Outline recommended immunizations for infants, describe care in the hospital for an infant, and plan appropriate isolation techniques. Provide emergency nursing care for children with complications, develop home-based plans, discuss alternative and complementary therapies, and develop a teaching plan. So immunizations and communicable diseases. So this is your immunization schedule. You can find this at the CDC website. It's also in your book, I believe. I got an older copy of your book, but I don't think that they would have changed this. So we'll just kind of talk about when all of these are supposed to be given. Hep B is given at birth at 1 month and after 24 weeks of age. Hep A is given after 12 months of age, given 2 doses at least 6 months apart. DTaP, so diphtheria, tetanus, and pertussis, given 4 times for infants and toddlers. It's given at 2, 4, and 6 months, and again at 15 to 18 months. Hib B is bacterium that causes infection in various parts of the body. The organism was at one time a leading cause of meningitis. It is a significant cause of conjunctivitis, otitis media, and sinusitis. So it's given at 2 months, 4 months, 6 months, and again at 15 to 18 months. They have an immunization for rotavirus that's given at 2 months and 4 months. Pneumococcal is given to children under the age of 5 to protect against meningitis, otitis media, and other infections. So it's also given at 2 months, 4 months, and 6 months of age, and then also 12 to 15 months. Inactivated poliovirus is given at 2 months, 4 months, 6 months, and 12 months. And then they get a booster at between 4 and 6. Influenza is given every year starting at 6 months old. They should always have that influenza shot starting at 6 months old. Measles, mumps, and rubella, 12 months, and again at 4 to 6 years. MMR is contraindicated in persons who are allergic to neomycin or gelatin. So make sure you find out what their allergies are before you start giving them shots. Meningococcal conjugate vaccine is given at 2 doses, 8 weeks apart, to children ages 2 to 10. If they're high risk due to immunodeficiency disorders, a booster is given every 5 years. So contraindicated if child is allergic to latex or has a history of Guillain-Barré syndrome. Varicella is also given on the same schedule as measles, mumps, and rubella. Tetanus, diphtheria, and so your Tdap is given at age 11 to 12. All persons 13 to 18 should have Tdap if not previously given. And then your HPV is relatively new. They're given to girls ages 11 to 18, and should also be given to boys ages 9 to 18 to prevent like genital warts and passing that on to sexual partners. So the final dose of DTaP is given at what age? Anyone want to guess? It's actually 4 to 6 years old. 4 doses are given for infant and toddlers, 2, 4, and 6 months, and 15 to 18 months. Final dose in the series is given between ages 4 and 6. DT is for children under 7 years of age who cannot have the pertussis component of the DTaP vaccine. So whenever you're working with kids, you also get boosters in adulthood. I think it's every 10 years you get a booster. That's what I've had to do every 10 years. So general history, physical examination, ask about exposure to different communicable diseases, consider the incubation period of those diseases. Has a child had any communicable diseases in the past? What shots have they had? Their physical examination, look for signs and symptoms that may appear before, like a rash, fever, any type of feeling sick. A lot of times it usually starts out by them feeling like they have the flu and running a fever. And then most time they get like a rash, and then you're like, oh yeah, well that's chickenpox. So it takes them a little bit of time to get to the actual disease process. Fifth disease looks like someone smacked you in the face. Caused by parvovirus B19. Kids 5 to 13 usually get this. Starts with a fever, headache, and cold symptoms. Then after that passes and you get a rash. You get red rash on your cheeks. It looks like someone smacked you. So it'll be right here on your cheeks. The rash then moves down to the trunk. So it kind of looks like this arm here. There's no treatment. Only treatment is for symptoms. And diagnosis by symptoms or by blood work for the parvovirus 19. So usually it looks like this little arm here once it goes down to the trunk. Hand, foot, and mouth disease is also common. It's common in younger kids. People get this all the time. It's a little different than hoof and mouth disease. I know that's for cows, but it is transmittable to adults or to kids for hand, foot, and mouth. So symptoms are fever, sore throat, malaise, painful blisters in the mouth, rash that doesn't itch but looks like blisters. So it's not itchy, it's just annoying. Sore develops in mouth 1 to 2 days after fever starts, followed by the rash on the hands and feet and sometimes on the buttocks. So it's the virus down here, the A16. I'm not going to try to even say that because it's long. Hepatitis A. So these are some facts about hepatitis A. It's a viral infection of the liver spread when fecal matter enters the mouth. I know, gross, yuck. But it lasts several weeks and can be debilitating. but most people recover pretty fastly. You get nausea, vomiting, diarrhea. It's preventable with careful hand washing. Most times it's spread in our restaurants for workers that don't like to go and wash their hands after they use the restroom. Spread by direct contact, food and beverages, cups and spoons. So they go use the restroom, forget to wash their hands, and then come out and spread it to everybody. So makes you not want to eat anywhere, right? Hep B, how someone can get it is direct blood to blood contact. Everyone should have their Hep B vaccines, especially working in healthcare. It can be given to mother or to the child from the mother during birth. You can get it from not using sterile things, from like getting tattoos or piercings. Make sure you see the people, if you're going to get a tattoo, see them open up the equipment in front of you. If you're going to go to a barber, and make sure you see them put on a new blade or clean their blades appropriately. Household contact, so sharing hygiene equipment like razors and toothbrushes, sharing needles, and then unsterile healthcare practices. So when you're checking people's blood sugars, when you're giving blood, when you're doing shots, make sure you're wearing your gloves. And it's also sexually transmitted. So the flu, this is a little video I found about the flu. Kind of tells you a little bit more about it.
Flu is a contagious respiratory illness caused by influenza viruses. When people with flu cough or sneeze, you can inhale droplets that contain flu viruses. The viruses infect your cells and make copies of themselves. Flu virus infection triggers inflammation in your body, which produces flu symptoms. Severe inflammation can cause lung damage and other serious problems. Your body's immune system responds by sending proteins called antibodies to fight the infection. Some people experience serious flu complications that can lead to hospitalization and even death. Flu vaccines have been shown to reduce the risk of catching flu and may lessen the severity of symptoms. Everyone 6 months and older needs flu vaccine each year. Join the fight against flu. Learn more at cdc.gov/fightflu.
So making sure that you get the flu shot every year is really important. It's not just your
cough, fever, body aches. You could have flu. Flu symptoms usually come on suddenly and are worse than the common cold. Flu spreads easily from person to person, so if you have flu-like symptoms, stay home.
There. So making sure that you do your flu shots every year is really important. And then not just for your protection, also protection of people around you. People like, who have had transplants. My father-in-law had a kidney transplant, and he's had 2 of them. He can't get the flu vaccine. His doctor doesn't allow it. So making sure that you're taking care of the people around you as well. Mononucleosis. So the symptoms of mononucleosis is throat soreness and reddening, lymph nodes, high fever, chills, and aches. So central fatigue, loss of appetite, malaise, headaches. Your tonsils are red and swollen. They have white patches. Your spleen can be enlarged, and you also have nausea and vomiting. This is kind of what an inside of the mouth looks like. That's mononucleosis. It's disgusting. And you can see it kind of looks like strep throat. So you'd have to be tested. Mononucleosis you can have for a long period of time and not even know that you have it. It kind of depletes your energy, and you feel tired a lot until you finally get antibiotics to fix it. So mumps. So signs of mumps will be fever, headache, loss of appetite, muscle aches, and tiredness. you have these symptoms, stay at home. And then you want to make sure and contact your doctor. There's no treatment for mumps. It kind of has to just go away on its own. It's best known for those puffy cheeks and swollen jaw, and it kind of looks like this. So if you see someone looking like that, that's a very clear case of mumps. Respiratory syncytial virus or bronchiolitis. Let's see if it'll play for me.
Heart rate's 120, BP's 140 over 90. Hectic first day.
Sorry.
But earning my nursing degree online gave me the...
There we go.
The respiratory syncytial virus, or RSV, causes infections of the breathing passages and lungs in infants and young children. RSV can cause pneumonia and is the leading cause of bronchiolitis, which is an infection of the bronchioles, the small breathing tubes of the lungs. RSV is spread by contact with infected secretions such as saliva and mucus from sneezing. RSV is most contagious during the first 2 to 4 days after your child begins to feel ill. An RSV infection can last between 2 and 8 days, but symptoms can remain up to 3 weeks. RSV occurs more often during the winter and early spring. Almost all children will have an RSV infection at least once before they are 2 years old. Most of the time, this virus only causes minor cold-like symptoms. However, for some babies, an RSV infection can be dangerous. For infants who are born early or born with heart disease or lung disease, an RSV infection can be especially serious. Premature infants often have underdeveloped lungs and may have difficulty fighting an RSV infection once they become infected. The signs and symptoms of RSV include fever with a temperature above 100 degrees Fahrenheit, cough, wheezing, runny nose, rapid and or deep breathing, blue-colored lips or fingernails, and poor appetite. In addition to these symptoms, there may be others. There are a number of ways that RSV can be treated. If your child has asthma or has trouble breathing, your doctor may try a bronchodilator to help open his or her airways. Some children who have bronchiolitis may have to be hospitalized for treatment with oxygen. If your child is unable to drink because of rapid breathing, he or she may need to receive intravenous fluids, which are given through a needle into a vein. On rare occasions, infected babies will need a ventilator to help them breathe. Antibiotics are not used for treating viral infections, including those caused by RSV. Any illness that makes it difficult for your child to breathe should be evaluated first by your child's doctor. At home, you can do the following things to help your child feel more comfortable. Give all medicines in the way your doctor or nurse practitioner instructs. Do not allow anyone to smoke around your child or in the home. Try using a cool mist vaporizer to soothe your child's dry breathing passages if this is recommended. Do not use hot air vaporizers. Saline nasal drops may help loosen mucus in the child's nose. Make sure your child gets plenty of fluids such as water and fruit juices. For fever, give your child medicines such as acetaminophen. Do not give your child aspirin. Blow little noses frequently. You can use a nasal aspirator for infants. Allow your child plenty of rest. You can keep RSV from spreading by taking these steps. Wash your hands thoroughly after caring for your child. Breastfeeding for at least 6 months. Respiratory infections are less common in children who have been breastfed. Avoid tobacco smoke exposure. A child exposed to tobacco smoke has a higher risk of bronchiolitis. Keep your children home from daycare when they or other children become ill. Wash toys between each use. Cover the mouth and nose when coughing or sneezing. Be sure to throw away any used tissues. Contact your child's doctor or nurse practitioner immediately if your baby or child is having trouble breathing, has a gray or blue skin color, has a fever that climbs above 101 degrees Fahrenheit, has thick yellow or green discharge from the nose, is younger than 2 or 3 months and has a fever, shows signs of dehydration such as dry mouth, crying without tears, and urinating less often. We hope you have found this information helpful. If you have any questions, please ask one of your caregivers. Thank you for choosing Cleveland Clinic for your care. This little light of mine, I'm gonna let it shine.
Okay, so RSV is important to make sure that you're not passing those germs along. If you have a cold, it's what it looks like. RSV is mainly for adults, just a cold. You can pass it on to kids, and it really causes problems. I've seen kids come in that have to be ventilated. There was a kid that had to have ECMO at one point because of RSV. So it can be quite dangerous for kids. Roseola, this is kind of what roseola looks like. Contagious viral illness. Where you guys over here so I can see. It causes high fever and then usually a rash that develops as the fever goes away. Most common effects is children under 2 years of age, but can affect older children. May take 5 to 15 days to develop symptoms. High fever, it can go up to 105, most contagious during the high fever. So, and it's usually before the rash even starts. So it's kind of hard to determine whether or not they have anything. And you take them out and you're spreading roseola everywhere. So as the fever goes away, the pink rash develops as either flat or raised lesions on the abdomen and the back. There's no cure, but goal of treatment is to help reduce symptoms. So just giving them Tylenol, making sure they're comfortable with that fever, giving them lotions to help with the itching of the rash. Rubella, or German measles. This is what it looks like. It's a rash transmitted by respiratory droplets. So mild illness, low-grade fever, erythematous papular rash begins on the face and then spreads to the trunk. Posterior cervical lymphadenopathy, say that word for me, lymphadenopathy. It's congenital infection, it's highly pathologic. It also has major birth defects if the mom gives it to the child. So measles, fever may spike up to 104. They have a cough, a runny nose, red watery eyes. Rash breaks out in 3 to 5 days after symptoms begin. There's no specific treatments. They just treat for making sure that their temperature's down, pain relief. Some kids get some vitamin A, especially if they're severely malnourished, because it boosts that antibody response. Chickenpox looks like this. So you can tell that this little chickenpox right here, that's usually what it looks like. These are kind of being healing, but it's just like a blister look. It's considered a mild illness, but child will probably feel pretty miserable. My sister had chickenpox when she was little. I gave it to her. I feel really bad about it. But she had it so bad that she had a seizure, like a febrile seizure from it. So she had to spend a couple of days in the hospital on my birthday, of course. So making sure that you're taking care of that fever, keeping the fever down, and then giving calamine lotion or cooling gels to ease the itch of those chickenpox. In most children, the blisters crust up and fall off naturally within 1 to 2 weeks, because after the chickenpox start healing up, they're no longer contagious. Conjunctivitis or pink eye looks like this kind of. and it's very contagious. So you have to make sure that you're washing your hands after touching kids with conjunctivitis. You also want to make sure that they take their antibiotic. If it's bacterial, it can be viral or bacterial. So if they're taking their antibiotic, they should be fine. And it should go away within a little while. Can have discharge. A lot of times the kids will wake up with crusties on their eyes and their eyes will be red, so you can kind of tell what it is. Pertussis or whooping cough kind of sounds like this. It's a very distinct cough.
Whooping cough. It's a bacterial infection that's risen to epidemic levels in some parts of the U.S. In adults, the symptoms can be mild, but if the infection is spread to a baby who hasn't yet received a full course of vaccinations, whooping cough can be very serious. Here's more on how to handle this disease.
Are you being shy?
21-month-old Pedro Escueda's symptoms started out like those of a typical cold.
He had a little runny nose and started having a little cough.
But over the next 4 to 5 days, Pedro's mom, Chelsea, says the cough got much worse.
It was nothing I've ever heard before. He was coughing and doing the whoop. He would vomit.
And he couldn't catch his breath. When they took Pedro to the doctor, the coughing had subsided, so they figured maybe it was just a cold or some other infection. But Chelsea knew there was something else wrong. So the next time Pedro had a coughing fit, her husband got it on video. A nurse practitioner saw it and diagnosed it right away.
And she saw it. She goes, that's pertussis.
Whooping cough is also known as pertussis. It's caused by a bacterial infection that is spread from one person with whooping cough to another person.
Dr. Thomas Boyce says whooping cough is particularly tough on kids younger than Pedro, who haven't had the full course of vaccinations given at 2, 4, and 6 months.
They're particularly susceptible to getting infection, and because of their small airway, they're particularly susceptible to having very severe disease.
You see, the infection happens in the airway or trachea. The pertussis bacteria produce toxins that irritate and inflame the airway. This causes the severe, repeated cough that lasts for months.
They call it the 100-day cough.
Pedro and his entire family took antibiotics to treat the infection and prevent further spread. Now he's back to health after months of illness. Dr. Boyce says babies usually get whooping cough from adults who have a mild infection. He says that's why it's important for adults to get booster vaccinations every 10 years. Ask your doctor for the tetanus diphtheria shot that also includes a pertussis booster. For Medical Edge, I'm Vivian Williams.
So you can see that it's kind of, that cough is very distinct, and you can hear it whenever they come in. Does anyone know why they could have just not had a cough after going to the emergency room? Why they thought it was just a cold? How that could have happened? Probably because whenever they went out into the night air that's cold, it kind of takes that cough away. It makes them feel better. A lot of people sit with them outside for a little bit to help them with their cough. So they probably went outside on their way to the ambulance or to the emergency room. He got some of that cold night air, and it kind of helped him with his cough. So by the time he got back inside a few hours later and at home, he started coughing again, and they were able to get that video. So these are kind of the symptoms of that whooping cough: low-grade fever, vomiting during or after coughing fits. Apnea, babies may have a pause in their breathing. It's a very scary pause for parents, so they'll start coughing and coughing, and then they just can't catch their breath. Exhaustion, after coughing for so long, they have a runny nose, and then they have this, as you could tell, that very distinct cough that you get. It sounds like you're about to cough your head off, and then you just kind of can't catch your breath, and all those bronchioles are closed, so it sounds like a really high-pitched squeal at the end. Strep throat or scarlet fever. signs and symptoms of strep throat. I'm sure most of you have had this before. Sore throat starts quickly, pain when swallowing, fever. Your tonsils are red and swollen and sometimes have pus. Tiny red spots on the roof of your mouth. You get swollen lymph nodes from your neck. Typically do not include cough, runny nose, hoarseness, or pink eye. That's how you can usually tell if it's strep throat or not. And kind of looks like this on the inside. If you look at anyone's throat, it kind of looks disgusting like that. Like, oh, that's strep throat, or possibly mononucleosis. So which of the following causes pruritus? You guys, did you guys see that? It's actually A, contact with, so it's mumps, contact with oral and nasal secretions or droplet spread. Incubation period is 16 to 18 days. And its communicability is 2 to 3 days before swelling of salivary glands to 5 days after swelling starts. So you've got quite a bit of time there that you can pass it on to other people. So just kind of in retrospect, we just looked at some immunizations birth to age 18, some assessments, viral communicable diseases, and bacterial diseases. Do you guys have any questions over anything? Okay, well, thank you very much for letting me talk to you. Thanks, Julie. And if you need anything else, please let me know. And I hope that you got the PowerPoint okay.
Yeah, definitely. Thank you so much for coming. We appreciate it.
Thank you. You have a great day.
Thank you.
Bye-bye.
Okay, guys, if you can just stay on here just for another minute or two. So I just want to get plans firmed up for when we're going to do our little thing, because I feel like we need to do a review so that you guys are ready for your test. So just remember, we have 2 tests on the same day again, unfortunately. So we'll have our PEDS test and we'll have our community test. So I think if we do Tuesday in the evening, that I could do that. That would work for me. So if that works for you guys, tell me what time do you think would be okay for most of you?
Any time works for me on Tuesday.
Okay.
I can do like 6 o'clock or after dinner sometime.
Okay. Anyone else?
I have plans like later in the evening, so if we could do it like a little bit earlier, maybe around like 5 or 6, that would probably work better for me.
Okay. How about everyone else?
5 or 6 works for me.
Erica, are you good with those times?
Anytime's fine.
Okay. All right. Well, let's try 5 then. So we'll try to meet on that Tuesday next week at 5. So I'll send you guys like a Zoom thing, a Zoom invite for that, so we can get together for that. I will get your things to know ready to go and send that to you here as soon as I can for both classes, so you guys can expect that. Did you guys get a chance to watch my stuff that I put on over the break? No, I can't hear everyone. All right, well, if you didn't get a chance to watch those things that I put on over break, please do so that you're ready to go. And then I will go ahead and send you more practice questions today for the community stuff so that you have that at least. Any questions about anything?
Nope.
Okay.
Is the test exam on, or the whatever thing on Tuesday going to be for both classes?
Probably just PEDS. I don't think you guys need it for community. I think you're all right with that.
Okay, just checking.
I think PEDS, we need it more so. If you, as you're looking at stuff, if you feel like there's something you need specifically with community, just ask me that day. That's fine. Okay? All right, we'll go ahead and get off here. We'll come back on at 12:30 for community. So you guys have a little bit of time in between. So if anyone didn't turn in their other stuff for class, for next class, make sure you do that in between here. All right, see you guys in a little while.